Oh, and good afternoon, everyone. Sorry, that was a funny hello. Hello, and good afternoon, everyone. All right. So for our afternoon class, what I have today is something that it's kind of been coming up a little bit, just in terms of whether you should stay home or come to program, depending on how you're feeling. And really, if you feel sick at all, you should stay home. That's just to keep everybody safe. I mean, that goes for staff and everything. But at the same time, I think a lot of people are more concerned about because, there's the flu symptoms, there's cold, with the weather changing and everything like that. So, where everything's going to go with this is, how do I check to see? I forgot my bracelet today. Anyway, sorry, a little distracted. So, do I have coronavirus? Also, it's good to know, say, with the holidays coming up, whether you should get checked by a doctor to find out. So for me, I get checked every month. So far, everyone has been negative, knock on wood, that it stays that way. So everything seems pretty good on that end. But say I do go somewhere, and I say I already got checked, says I'm fine, then I go to a family party or something like that, which would be very small. But even so, you never know how fast it could spread. So the CDC has this thing, and I will send one out to you just to have, you don't have to do this. I'm going to do it now, just to kind of go over it with you. But it's a self-checker, a coronavirus self-checker, to kind of find out if, you do have the coronavirus, or if you should go seek medical attention to know for sure if there's anything like that going on in your system. And so for me, it's good, just in case, hey, maybe I should get tested twice. Because I've done that before in a month, where I'm like, it's not that I'm not sure, but I was out camping, and after I got back, I was like, I'm going to get checked again, because I want to make sure that everybody at program is safe, and that's the most important thing, is that we're all safe. And again, if you're really feeling sick, though, stay home. It could just be a cold, and if it passes in a day, then then it's just like a common cold. But if these symptoms persist, then that's what we need to do, is get checked. So it's just on the CDC website. Like I said, I'll send it to you just as something, as a frame of reference to have. So if you ever do want it, it'll be right there on your phone. Or you can go back to our WhatsApp. I guess I'll share it to WhatsApp as well, so that we can have it on both platforms. Well, this says, so first you have to agree. The purpose of the coronavirus self-checker is to help you make decisions about seeking appropriate medical care. The system is not intended for the diagnosis or treatment of disease, including COVID-19. So this project was made possible through a partnership with the CDC Foundation and is enabled by Microsoft's Azure platform. So continue using this tool. Please agree that you have understood the disclaimer, the contents of this disclaimer. So, I agree. And it says, hi, I'm Claire. I'm going to ask you some questions. I will use your answers to give you advice about the level of medical care you should seek. If answering for someone else, please respond to all questions as if you are them. If you need to start over, refresh the page and start again. It says, if you experience a life-threatening medical emergency, please call 911 immediately. So if we're bleeding or something, this is not the thing for it. So if you're not experiencing a life-threatening emergency, let's get started. So the CDC recommends these steps to reduce your risk of getting and spreading COVID-19. Get the vaccine, that's number 1. 2, wear a mask over your nose and mouth. 3, stay at least 6 feet away from other people who don't live with you. 4, avoid crowded areas and poorly ventilated spaces. And 5, wash your hands with soap and water, or use hand sanitizer with at least 60% alcohol. Okay, during this assessment, you can refresh the page if you need to start again. Are you in the United States or United States territory right now? Yes, I am. Where in the United States, in which U.S. territory are you located? So go to, Oh, there's California and California, not Los Angeles County. Well, I'm not in Los Angeles County. Submit. What is your zip code? Okay, well, none of you need to know my zip code, but I hope you know your zip code. Are answering for yourself or someone else? Myself. Are you fully vaccinated against COVID-19? So that means you are considered fully vaccinated 2 weeks after your second dose in a 2-shot series like Pfizer, Moderna, or 2 weeks after a single dose of Johnson & Johnson. Yes, I am. What is your age? None your business. Just kidding. I'll put in my age. What is it? 16 and 21. Is that? So what sex were you assigned at birth or your original birth certificate? Male, female? I prefer not to say. I don't know. I'll answer that however I felt like answering it. How do you currently describe yourself? Male, female, transgender? I prefer not to say. Well, I'm not going to let y'all know. Are you of Hispanic, Latino, or Spanish origin? Yes, no, I prefer not to say. Then it says, what is your race? Please select all that apply. There's white, black, or African American, American Indian, or Native, or Alaska Native, Asian, Native Hawaiian, or Pacific, or other Pacific Islander. I prefer not to say. So, do you have any of these life-threatening symptoms? Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to stay awake, inability to wake or stay awake, pale, gray, or blue colored skin, lips or nail beds depending on the skin tone. I think I look alright, unless one of you sees something different, but this list is not possible for all of them, so do I have any of these? No, I don't. The last 2 weeks, have you been in close contact with who has COVID-19? And it helps you with it. So you have been in close contact if you have been within 6 feet of someone who has COVID-19 for a combined total of 15 minutes or more over a 24-hour period, or provided care at home to someone who is sick with COVID-19, or C, had direct physical contact, hugged or kissed with someone who has COVID-19, or D, shared eating or drinking utensils with somebody who has COVID-19, or E, been sneezed or on or coughed on by somebody who has COVID-19. So it says yes, no, or I don't know. And if you're having symptoms and you say, you can say I don't know. One thing here's, I'll answer how I answered. Last sentence, have you been tested for the coronavirus that causes COVID-19? So I have been tested in the last 10 days and my test result was positive. I have been tested, my test result was negative. I have been tested and I'm still waiting for my result, or I have not been tested within the last 10 days. So I haven't been tested in the last 10 days. It wasn't, actually maybe, it's pretty close. But I've got to get tested again soon. So. In the last days, have you experienced any of the symptoms listed below? Fever, cough, there's more to it, mild, moderate difficulty breathing, sore throat, muscle aches or body aches, unusual fatigue, headache, new loss of taste or smell, congestion or runny nose, nausea or vomiting, diarrhea, other symptoms, or no symptoms. So I haven't had anything that's consistent. There's some things that are on there that maybe you have like a little cough because of allergies, and things like that. But what they mean is a consistent sort of thing, where it's just like, yeah, it's just not going away. So I submitted what I think. Do I live in a long-term care facility, nurse, or homeless shelter? So housing or at an institution of higher education? I do not. Last 2 weeks, have you worked or volunteered in healthcare facility as a first responder? Healthcare facilities include hospital, long-term. No, I haven't. Based on the answers given, you do not need to quarantine or get tested unless recommended or required by your healthcare provider, employer, or public health official. So they're saying that I'm okay based on what I said. And then it says, will you answer 2 questions about your experience with the screening test tool? Yes, I will, because I'm nice. Was it helpful? Yes, somewhat, or no? Yes, it was. Based on the information provided here, how likely are you to follow these recommendations? Very likely, somewhat likely, not very likely, or not likely at all. I would say very likely. Thank you for completing the coronavirus self-checker. So again, like I said, this is more for if, and I'll send it to you after the class. Well, yeah, after everybody said that they've watched the class. I'll send it out just so that you have it, and it's something that you can do just in case you want to get checked. And if you have like multiple things, like I said, in those, because maybe you have one or two and they might still say, hey, no, you're fine. If you have multiple things on there, then they might say. So it's still a good tool to have. But anyway, let's stay safe out there. Again, if you're ever feeling sick, and I can always try to switch up groups, and I'll take somebody else and try to take you on their day or switch up like that. But if you're not feeling well, I really prefer everybody stay home and stay safe and stay healthy and happy. Anyway, miss y'all. I'll talk to you soon. Bye.